This presentation is on Zulu perspectives on mental health. A key goal of psychological research is to help people suffering with psychopathology. To achieve this goal, research focuses on understanding concepts of abnormality, how expressions of mental illness are identified, and the treatment methods that are appropriate. From a cultural relativist perspective, culture adds a significant dimension to psychological research, as this concept suggests that normality and psychopathology can only be fully understood within the context that they arise. Culture shapes how we interpret emotions and behaviors, determining what is normal and what is considered a mental illness. Daniels and colleagues, and Munsami and Gurya, emphasize the need for research on mental health in Zulu culture as Western perspectives dominate current discourses, failing to consider the relevant cultural context. Now we get into my approach. Institutionalized models of mental health care in South Africa often rely on Western perspectives, which may inadequately support Zulu individuals. This presentation provides a general overview of Zulu perspectives on mental health for individuals living in South Africa, focusing on the conceptualization, identification, and culturally appropriate support and treatment of mental illnesses. Although this presentation will not make cross-cultural comparisons, I recognize the limitations a Western researcher may encounter in their assessment of mental health in Zulu culture, as literature on standard assessment techniques suggests that there may be problems of bias or insensitivity when psychological tests and methods developed in one cultural context are used to assess behavior in another. To avoid errors and the inclusion of information unrepresentative of Zulu perspectives on mental health, I prioritize information from peer-reviewed sources that use culturally sensitive approaches, similar to the cultural formulation interview model that aim to elicit a Zulu cultural concept of distress. Here is a brief overview of Zulu culture. Human cultures are distinctive systems of meaning and information, shared among groups and across generations that enable groups to fulfill survival needs, seek happiness and well-being, and find purpose in life. Important markers of Zulu culture are spoken language, geographical location, engagement in ceremonial activity, and recognition of unique cultural identity. Zulu culture is one of the largest cultural groups in South Africa. Zulu culture fosters collectivist values. Although many Zulu people adopted Christianity during colonization, most still hold strong beliefs in ancestral involvement, magic, and spirituality. Continuing our introduction here, approximately 10 million Zulu individuals live in South Africa's KwaZulu-Natal province. The KwaZulu-Natal province was specifically created under apartheid for Zulu individuals. It is within the KwaZulu-Natal province that Zulu traditions thrived and survived, including traditions such as the Ngoma dance that once served as a battle cry and is now performed at weddings and coming-of-age ceremonies. The concept of mental illness in Zulu culture. There is no neat concept of mental illness or psychological disorder in Zulu culture. Zulu culture generally follows a binarized classification of people as either healthy or mad, with no intermediate terms. The state of mental illness or madness in Zulu culture is referred to as ahomya. Researchers posit there exists no spectrum of mental states within ahomya, as such classification has not been practically necessary for the culture. However, generally, Zulu individuals understand mental illness to be the result of a lack of harmony between an individual and their environment. A lack of harmony causing mental illness can stem from realms such as social relationships, connections to nature, spiritual relationships, and relationships with ancestors. Identifying a mental illness in Zulu culture. Since the concept of mental illness does not exist neatly in Zulu culture, identifying the specific behaviors or emotions that constitute mental illness is difficult. However, from interviews with Zulu individuals, themes of antisocial behavior, failure to fulfill an esteemed functional role within society, and an absence of value to the community are recurrent in explanations of what it means to be mad or mentally ill within Zulu culture. A reluctance to seek mental health support. Mental health support and recovery responsibilities are shared by the individual and their community, as the whole community is seen as vulnerable to the same illness. However, at the same time, Mentally ill individuals in Zulu culture are often subject to social stratification or ostracization from their communities due to their failure to provide value to their community and fears of mental illness being contagious. Due to fears of ostracization, research shows that Zulu individuals commonly choose to remain silent about their mental health struggles and suppress their emotions. This ingrained idea of strength through silent endurance of hardship is believed to be the consequence of the historical apartheid regime in South Africa. Appropriate responses to mental health concerns. Despite a common reluctance to admit mental health struggles, support, when sought, is primarily sought from each other in Zulu culture. Zulu individuals and their families report feeling most comfortable in seeking mental health support from their spiritual community. For a Christian Zulu, this would mean turning to their church or pastor for guidance. For a traditional Zulu, a sagoma or traditional healer. Since mental illnesses are typically understood to be the result of a lack of harmony between the afflicted and their environment, responses to mental health concerns often involve attempts to restore the balance in an individual's social relationships, connections to nature, and relationships with ancestors. Additionally, researchers have found that a referral to institutionalized mental health services occurred only when symptoms of mental illness manifested physically, such as poor appetite or headache, or when peers who have used institutionalized mental health services noticed their symptoms. Now, based on my research findings, I'd like to add some of my own commentary and recommendations on ways institutionalized mental health services in South Africa can be improved to be more inclusive for Zulu individuals. Recommendation number 1, mental health support for individuals from Zulu culture should consider its collectivist nature by creating interventions that involve family or community members. As mentioned, from a cultural relativist perspective, the only way to understand psychopathology and normality is to consider the cultural context in which they occur. In considering the collectivist nature of Zulu culture, community involvement in mental health support for Zulu individuals is appealing. We'll discuss this more in the following case study. So, in this case study, we have Nonhal, a 19-year-old Zulu woman who moved in with her partner's family after losing her mother and being rejected by her father. Nonhal discovered her partner had another girlfriend. Shortly after the birth of her baby, she became withdrawn, inattentive, and suffered auditory hallucinations. The family sought institutionalized medical treatment for Nonhal, and her condition began to improve with antipsychotic medication. The family also consulted a diviner, a traditional healer, who attributed Nonhal's illness to sorcery and referred her to a herbalist. The herbalist treated Nonhal and encouraged her partner to end his other relationship. With institutionalized medical treatment, traditional care, and the involvement of Nonhal's community, Nonhal fully recovered and felt accepted within the family. In this case, community involvement in mental health support proved effective, highlighting the potential benefits of addressing the collectivist nature of Zulu culture in mental health care. Recommendation number 2. The isiZulu language plays a crucial role in expressing personal experiences, and providing resources or therapies in isiZulu would be beneficial. Language differences reflect important differences between cultures. Further, linguistic relativity, or the Sapir-Whorf hypothesis, suggests that speakers of different languages think differently than one another. Providing services in isiZulu would help make healthcare institutions more inclusive for Zulu individuals who wish to access this form of mental health support. Recommendation number 3. Work towards developing a form of psychotherapy that is tailored to the needs of Zulu people. As mentioned, the Zulu culture is one of the largest cultural groups in South Africa. Contemporary psychologists recognize that approaches to psychotherapy are bound to cultural norms, values, and beliefs. Thus, to adequately support the large number of Zulu people who may be afflicted by mental health concerns, the development of a psychotherapy tailored to their cultural perceptions of mental health would be beneficial. That brings us to the end of my presentation. Ultimately, more research is required to fully understand Zulu perspectives on mental health. My research is limited to the availability of the studies performed to date and the research methods employed and the objectives of such studies. However, in conclusion, Zulu perspectives on mental health emphasize community, spirituality, ancestral involvement, and magic. These views should be honored in institutionalized care to make it more welcoming for those who choose it. It is my hope that this presentation contributes to the ongoing discussion of making mental health services more inclusive for all cultures.